Welcome back. November is Lung Cancer Awareness Month, and Dr. Ravi Patel joins us this morning to talk more about the leading cause of cancer in the United States. Dr. Patel, thanks so much for joining me.
Thank you, Alex.
So, lung cancer is, of course, it impacts so many people in our community, unfortunately. I want to first talk about who develops lung cancer in our community?
So, there's a direct relationship with smoking, and fortunately, people are starting to smoke less. But it still has an impact. If you continue to smoke and you're a heavy smoker, you can develop lung cancer. And if you're a heavy smoker, we wanted to make sure that the community gets checked out with what is called a low-dose CT scan. So it's not an invasive test where we inject a dye. You come in, if you've smoked 1 pack of cigarettes a day for 20 years or 2 packs a day for 10 years, you can come in, call us, we'll do the free low-dose CT scan, which can pick up activity in the lung and can be helpful.
If you were someone who doesn't smoke,
yes,
can you kind of say like, oh, I don't need to worry about this?
No, there is a small percentage of cancers which can happen in non-smokers. So, any symptoms which you have related to cough, shortness of breath, if it's not going away, it's a good idea to bring it to the attention of your physician.
Because I know that you always talk about it's so good to be preventative, especially when it comes to these cancers. I want to talk about air quality as well, because we are one of the worst places in the country when it comes to air quality. And there's always these concerns about, well, the air that I'm breathing. Are there any correlations between our bad air quality and lung cancer here in Kern County specifically?
Yeah, I'm glad you brought up that, the armpit of California.
Yeah, exactly.
So, no, there is definitely lung issues with the poor air quality, but not that strong relationship with the cancer itself. So, it's a good idea, of course, to be in an area where you're avoiding bad air quality. And, if we have a bad air quality, don't be fearful that you're going to get cancer from it.
What about people, when we talk about smoking, I think a lot of people think of just smoking cigarettes. Are there other products, though, if you smoke other products, is there also a correlation to lung cancer, or is it primarily just cigarettes with tobacco in them?
I'm glad you brought that up because, smoking, we know, has a definite connection. But another significant issue which is happening is young adults like to do what is called vaping.
Right.
And the problem with the vaping is that the chemicals which are used in vaping precipitate in the lung and can produce significant lung issues. So it may not lead to cancer, but if you get serious infections in the lungs, what is called bronchiectasis, abscesses, it's dangerous. So, if you're vaping, give it up.
Yeah, because there's still other issues. Again, I know you talked about the screening. What else can people do right now to protect themselves and really take advantage of getting the notification that they may have an early stage lung cancer diagnosis? What can they do right now to make sure that they're staying ahead of the game?
So if you've been smoking, for sure, if you've smoked for 10 years, get a low-dose CT scan.
And how can they go about that? Do they contact your office?
They contact our office.
Okay.
It's a non-invasive test. They come in, they get a CT scan, we look at it, and it's done.
They can just call.
And it's for free.
Okay, all right. So call CBCC to get that free scan. Dr. Patel, thank you so much. Appreciate it.
Thank you.
All right.